how's it going? It's Dr. Greg Marion here at One Spine Chiropractic. Today we're discussing knee pain and a few of the tests we do orthopedically to figure out where that knee is causing our issues. The knee is a very complex joint, as you know. You have the bones, but more importantly, you have several muscles, tendons, and ligaments that surround that or even innervate that area. So we want to make sure when we have knee pain, we know what we're dealing with, that we can do a course of action. We'll do that properly and make sure you get the results you want. But what we're going to do today is show you some tests that we do in office to figure out if it's coming from a tendon, ligament, or maybe a meniscus injury. So the big test we do for meniscus injuries is called Thessaly's test. So what we want to do is get on one leg, weight bear on that leg, and you're actually going to rotate both ways. Okay, and if you feel any pain in the knee, especially the inside of the knee, more than likely you have a meniscus irritation or injury. So that's one of the things that we want to do, either get that inflammation out with some laser therapy or even some shock wave to break up some cartilage, scar tissue that might be around that area. And the other test we're going to do and test for is the patella test. So this is called a patellar grind test. What we do with the patient is put pressure right on the patella, and then we're going to squeeze and rotate around, make sure there's no pain. Next thing we're going to do is have the patient contract their quad. Good. If there's any pain in that area in the patella between this muscle here, or even below, a lot of times we've got tendonitis in that patella, known as runner's knee or patellar femoral syndrome. So what we want to do with that as well is make sure we get that inflammation out. If that's been there chronically a long time for some of our runners, like we mentioned before, shockwave is a great therapy for that because it breaks up some of that scar tissue and adhesions to get things gliding and sitting properly and working properly. Okay. Another test we do quite often here is the ACL-PCL test. What that's going to do is test the ligaments in the knee because here in our office we see a lot of athletes, a lot of athletes that play football, soccer, and things like that. So that's one of the typical injuries we have for a knee is damage to the ACL or PCL. So what test we do for that is we get the knee up here, and what we're going to do is have the patient kind of dig into the base there, and then we're going to push. And then we're also going to pull and slide. So what we want to do is make sure there's no pain with either of those motions, but also what I'm evaluating for is make sure there's no laxity in there. Because a lot of times when it's a recent injury from a sports injury, a lot of times that laxity means there's a tear in one of those ligaments. So we want to determine where that pain is coming from by doing some orthopedic tests like we're doing here. That's something that leads to us getting a positive sign. We might even take some x-rays to determine what's going to be the best course of action, get you the results you need. More importantly, safe, effective, and it works really well here. So give our office a call if you have any knee injuries. We'll be happy to help. Thank you.